Magandang araw Luzon, Visayas, Mindanao, and to the world. At sa ating mga nanonood sa atin through our Facebook, sa ating DZRH News television page. Maraming salamat po. Lalo na po doon sa mga continuously nagko-comment sa atin at nag-a-ask ng mga kanilang mga questions about their health. Ito po ang inyong programa. Para po sa inyo ito, para po masagot ang inyong mga problema. And welcome po sa programang Bidang-Bida ang ating kagandahan at kalusugan. Ang programang magbibigay sa atin ng mga dapat nating malaman, lalong-lalo na po sa ikabubuti ng ating pangangatawan. Ito po ang inyong matatakbuhan sa problemang pangkalusugan. Ako po ang inyong lingkod sa inyong tungkol sa ating kalusugan, syempre. Ang inyong mga kasama ko po si Vian Dacles at ito po ang Pinoy Health and Wellness. At sa araw na ito, maganda at makaka-relate kayo sa ating pag-uusapan. Pero bago ko po sabihin sa inyo ang ating pag-uusapan for today, we have here today ang ating guest doctor. At hindi na po siya naiba sa atin dahil nakasama po natin siya. And it's an honor to have you back, Dr. Ron Samaniego of Active Life, Chicago Physical Therapy.
Yeah, thanks for having me back. Thank you.
Thank you so much. At magandang turnout ng ating unang mga interviews, Doc.
Oh, that's good.
Marami talaga mga nag-comments. And some pa nagsabi na nakita ka na nila and na-try na daw nila yung inyong mga services.
Nice.
And kamusta naman, Doc, ang inyong day? Kamusta din ang inyong business so far?
So far, so good naman. Medyo binagyo tayo, pero you know, so medyo open siya ngayon. Pero okay naman. So far, so good.
And sa ngayon ba, mas marami nang nakakakilala sa kanila? At marami na ba mga patients na talagang pumupunta sa inyo?
I believe it did. You know, it helped get the word out that we're around, that we have these services na maaaring makatulong.
Ngayon ba, Doc, meron tayo mga bagong ino-offer sa inyong clinic?
Pretty much the same thing. I guess ang pinakabago namin ngayon yung parang yung pulse electromagnetic field. It's something na it's like a magnet therapy na very, you know, it leads to healing. Really nice machine.
Na para dun, basically ano yung tinitreat niya, Doc?
Musculoskeletal condition, neck pain, back pain, shoulder, you know, joint pains, sports injuries, anything that needs healing.
Ayan. Alright. At dahil nabanggit nyo na, Doc, kung ano yung mga services na ibinibigay ninyo sa inyong clinic dito sa Active Life, Chicago Physical Therapy, ang ating pag-uusapan ngayon, Doc, very much na makaka-relate ang mga Pinoy dito. Lalo na yung mga office workers at doon sa may mga maling pagtulog. Tama po ba, Doc?
Yeah, definitely.
Dahil ang ating topic for today ay tungkol sa ating mga neck pains. Very, may mga pagkakataon talaga ako nakakaramdam din mismo ng neck pain. At minsan, sobrang hassle. Lalo na pag pumapasok ka sa office, Doc, no?
Yeah.
For this kind of pain, Doc, what are the usual causes? Bakit tayo nagkakaroon ng ganitong klaseng pain?
Oftentimes, you know, wrong posture. Number one is stress, obviously, di ba? Kung papanoorin yung mga bata, minsan pa nagagalit sila, di ba? They go like this.
Yes.
They like clench onto everything. Oftentimes, mga taong stress, imbes na bumalik yan pababa sa kanila, they hold that pattern hanggang sa naging yan yung normal nila. Hanggang sa nakukuba na, hanggang sa nakayuko na. Tapos sasabihin na, masakit yung leg ko. And then they don't even notice this. Diba? Sadly, they don't notice this. Malalaman lang natin na masakit na talaga pag pumunta na sa doktor or PT, and that's when, you know, they're being told na, okay, you got some problem in it. Maaring disc, maaring nerve. It could be for every different reason.
Ano yun, Doc, usually, like sabihin natin, kunwari sa pagtulog, ano yung nagiging problem doon? Or may particular part of the neck ba na talagang yun lang yung usual na sumasakit for neck pain? Usually
yung upper traps area, yung trapezius area na banda rito sa gilid. Kasi ito naman talaga yung nagsusupport ng neck natin. One of the big muscles na nagsusupport. And it's for posture. And oftentimes, for some people, makikita mo, bilog siya eh. Sa mga bodybuilder talaga, di ba? They're so ripped na talaga nakaganon sila, di ba? It pulls them back. For some people, imbis na pinapull sila backwards, nakaganito eh.
I see, oo.
Right? And oftentimes, the upper traps is being blamed for that. It could be it's too much stretch, may stretching na nangyayari, or it's contracted, di ba? One way to know is to actually look at the person and see, okay, hey, you know what, yung upper traps mo masyadong banat, maaaring yung chest area mo, it's pulling you down.
I see. Oh. Parang sabihin natin medyo masyado siya mabigat for the shoulders. Parang
it could be the weight of the head and the upper body.
Yung mga ganyan, Doc, for the neck pain, sino yung mga usual na nagkakaroon ng sakit ng ganito?
Anyone, from young to old. But oftentimes yung mga office workers, yung mga tutulog sa maling kama. Kasi sa Philippines, may natutulog pa rin sa papag, may
Yes,
natutulog pa rin sa
oo.
matitigas na lugar. I used to sleep on a bench Di ba? Until mahulog ako. Di
So
ba?
for that, Doc, ibig sabihin, dahil lang may maling posisyon ka, it can cause to neck pain already.
It could be a factor. It could be a factor. But there are also underlying cases na medyo mas serious. Kung hypertensive siya, di ba? Mataas yung BP niya. Yeah, that could be ruled out by going to a doctor. No? Tingnan natin kung talagang mataas ba talaga ang BP mo, meron ka ba medication na tinitake. And then pag na-address mo na yun at ganun pa rin, then it could be something na musculoskeletal na. It's something that we address.
Kung let's say, Doc, hindi muna natin kailangan ng PT for this one. Kunwari, bigla lang siyang sumakit. What medications na pwede nating i-apply for that person na merong neck pain?
Maaring medications or maaring yung mga hot pack or cold compress, depende kung ano yung hiyang ka eh. Kasi often nagtatanong na sa akin, Doc, should I take hot or cold?
Exactly. O ano po ba yung yung better para sa ganyang klaseng pain?
I'd say kung saan ka kung saan ka mas komportable.
Okay.
Diba? All the books would say, okay, you need to do hot packs. Pag medyo matagal-tagal na or cold pag bago pa. Pero the way I see it, kung ano yung pabor sa'yo, kasi there are some people na pag binigyan mo ng cold kasi bago pa. Sabi niya, Doc, pag ni-aircon nga ako, sumasakit na yung leg ko, bibigyan mo pa ako ng cold, di ba?
I see, oo.
So whatever works for that person, di ba?
Ibig sabihin, Doc, it doesn't matter na, kunwari, kasi usually ganun yung nire-recommend lalo na ng mga parents. Ano ba masakit sa'yo? Sige, mag-hot compress ka muna, lalo na pagka muscle pain. Tapos pag cold yata, ay parang for pasa, mga ganyan
Mga bago, something new.
So, ibig sabihin, it doesn't matter, sa person talaga siya.
Yeah, doesn't matter. Kasi ikaw naman yung gagamit nun eh. Diba? Ako personally, I like cold. Yeah, but a lot of people like heat.
So, pag ganun, Doc, gaano katagal mo siyang dapat i-stay dun sa portion na masakit sa leeg?
Around half an hour. You know, you can even go up to an hour, di ba? Pero syempre, you gotta check it every now and then. Baka nasusunog ka na kasi ice could burn you, no? So, you gotta check, nasusunog na ba ako nito? And importantly, guys, don't sleep on it. Kasi may mga natutulog sobrang komportable, tutulugan nila yon.
Bakit, Doc? Ano possible na mangyari kung kunwaring natulugan mo siya, nalimutan mo,
It could burn your skin. Pag gising mo, pambira, bakit may grade 2 burns na ako? Di ba? Parang napaso ng mantika minsan. It could happen. And we don't, obviously, we don't advise you sleeping while you're doing this.
So, dapat meron ka ring at least someone na mag-check din.
Watching you or someone who's reminding you na, oy, matagal na yan, 1 hour na yan, tama na. O half an hour
Tanggalin mo
na yan.
Yung ganun, Doc, how frequent yung paglalagay ng ganyan? Or just once lang?
As much as you want. Ang kagandahan nito, you're not gonna go overdose on this. Of course, you gotta watch your skin, pero as much as you can do this.
Basta as long as masakit pa siya.
So masakit siya, you could use.
Okay lang.
One trick that I teach in my office is that yung efficacy oil, let's say you rub it on your neck, and then you put like saran wrap yung plastic, and then you put a little bit of padding like bimpo, and then you put your heating pad.
I see.
Mas effective siya.
Okay. What's the reason, Doc, bakit siya more effective kaysa dun sa paglalagay lang ng pack?
Kasi mas receptive yung skin mo gawa ng efficacy because of the mint or that's in it o yung ointment na nandun. Mas madali niyang na-absorb yung heat
I see. So, that works well kaysa dun sa pack. Okay. Eto, Doc, total nabanggit na ninyo kanina yung possible na other implications kapag meron kang, pag meron kang neck pain. Ano pa yung posible, kunwari, hindi siya magamot for some reasons, yung neck pain. Ano pa yung posibleng sakit na parang sabihin nating naging katandem nung neck pain?
Yung una muscular. Oftentimes naman pag sa neck, usually it's the muscles that inhibits or limits the motion. So oftentimes makikita mo yung mga taong ganyan Ito lang yung imbis na they could go real high up or they could not even turn their head, di ba? Isa pang katandem nun is yung, like I said, yung kanina, yung kung mataas ang BP mo.
Yes.
Diba? The other issues is maaaring mas malala na siya. Meron palang disc na nagpa-pop out sa likod, touching the spine, causing more pain. And sometimes even shoots down the arm. A lot of people could relate to this kasi often when they come to me, Doc, may may shoulder pain ako. But when I check, it's not a shoulder pain, it's a neck pain. So, hindi nila alam na galing pala dito, nag-shoot down na sa arms.
I see. Ano yun, Doc? Kasama ba doon dahil may problema na sa nerves niya or something?
Yeah, naiipit na yung nerves. So, yung nerves na nasusupply down the hands, obviously, naiipit. So, common symptom is, or common nararamdaman yung parang kuryente, nag-ground sila, o kaya parang ngalay na ngalay itong area na to. Kasi that's the main reason why they come to us eh. Ang tagal nito, ngalay itong buong side na to. Yeah,
So, ibig sabihin, Doc, aside from the nerves na naiipit, could, yung neck pain po ba, pwede siyang mag-lead din dun sa, yung parang lower back pain natin?
Yeah, definitely it could. Kasi they're both weight-bearing joints eh. You look at the spine, pareho sila naka-concave eh. Looking at the side, pareho sila naka-concave. So, kung hindi na kayang buhatin ng neck, sino bubuhat?
Yeah.
Obviously, the lower part,
back.
di ba? Kung hindi na kaya ng lower back, sino bubuhat? Siyempre, yung tuhod naman. Or ankle. So, it's a bad chain reaction that could happen over and over again if it's not addressed.
Yung neck pain, Doc, pwede bang dahil din yan bukod sa maling pagtulog, maling pag-upo, or maling pagtayo, posible din ba yung matagal na pagbubuhat, like yung mga bags, o kaya, lalo na yung mga Pinoy, na may mga trabahong talagang ang usual na ginagamit nila yung mga balikat nila or pagbibit-bit ng mga mabibigat na bagay?
Yeah, I believe so. Kasi sometimes when I test for a neck, I put their hands out this way, tapos pinipress down ko eh. Oftentimes walang lakas to eh. And then that's when I know, okay, meron kang problems sa neck and thoracic area mo, no? Yung lower part ng spine mo. And when we address that, magugulat sila, uy, ba't ang lakas na? Kasi we were able to reposition the joint or we were able to make the muscles fire around the area. No?
Yeah. Alright, ito Doc, yung mga ganyan, for some na mga hindi kayang pumunta sa mga doctors or sabihin natin na medyo takot pa to try like physical therapy, ano yung mga usual na home remedies aside from the packs na nabanggit natin kanina?
I usually tell people to take some ibuprofen or some non-steroidal anti-inflammatories. Obviously, you gotta watch your stomach when you do this. No, dapat busog kayo. Kasi it could ruin your stomach big time. Yung gastric acidity, it's really bad with NSAIDs. Other thing you could do is a little bit of stretching every now and then. Let's say you're in the computer for like an hour. You might want to do a little, kahit 1 or 2 minutes lang. It's not gonna wait. You're not gonna waste your time doing this. That simple neck stretch, side to side, up and down. You could do that. And other things that you could do is people love massage. Go for a massage. Yeah, ako I do it once or twice a month. Kasi no one works with me. So,
oo nga naman. Parang din siya, Doc, no? It's like a maintenance na rin.
Yeah.
Para hindi bumalik ng bumalik.
Yeah.
So, for office workers, lalo na yung mga walang time to do the, parang to visit clinics, yung nabanggit mo kanina, Doc, aside from moving your neck, from time to time, is it really parang kailangan na hindi sila magstay dun sa position na yun? Dapat from time to time tumayo sila, maglakad?
Yeah, every now and then you gotta move around. In fact, when I was playing the Wii, yung Nintendo Wii, it encourages you to stop. O, stop ka muna. Pahinga ka muna. Gawin din, overactivity or lack of it, it's not good. So you wanna stand around, walk around. Sometimes, going to the grocery helps. Kasi that's when you use your eyes and your head to look around for stuff. So instead na nakapokus ka lang sa isang computer where your eyes are moving really fast, now the muscles are twitching because of that. Which causes more injury in the process.
Ano yun, Doc, for the neck pain, ano yung pinaka-worst by far dun sa inyong experience na? Ano yung pinaka-matinding effect nung mga may neck pain na hindi na-address?
Pinakamatindi is yung nakuba na. Nakakuba na siyang gano'n. Tapos pag hinawakan ko siya, wag mo akong hawakan.
As in, kahit i-touch lang siya, Doc?
Kahit i-touch mo siya, masakit. Sobrang sakit. She was referred to me by an orthopedic doctor. Talagang kahit sabi niya, I went to everyone, Doc, this is my last, Nung una, hindi ko talaga siya mahawakan. So we had to do we have to use our machines na non-contact. Until such time na, okay, pwede na ba kitang hawakan? Oo, kaya ko na. Yun yung pinaka-worst na nakita.
Anong ginawa niyo doon, Doc? Kasi if you can't contact her directly, parang hawakan siya or anything, paano niyo siya na-treat?
We use light touch machines. Meron kayong mga machines na vibratory, na percussive din, pero light touch lang yung namit namin. Kasi konting hawak lang masakit na eh. Sabi ko sa kanya, isin mo to kasi kung hindi ko gagawin to, nothing's gonna happen for you. Nothing's gonna change. So we use that, and we use another form, yung laser. We use laser because laser is non-contact. So yung light lang yung tumatama sa kanya, and she loved that kasi she loves the heat. In the beginning, yun lang yung kaya kong gawin.
So for how many times, Doc, nyo ginawa yun hanggang dun sa nahawakan nyo na siya?
I think umabot ng 8 visits before ko siya nahawakan.
Wow, din.
But you have to understand that this person has been to everyone.
Yeah, so ganun ka-severe yung ano niya, yung kanyang status nung araw niya, yung case niya. Tapos, Doc, ano nangyari after that? Ngayon, ano na yung status nung
Ngayon, she's
patient?
back to work. I think she works at a call center office pero hindi siya call center agent, she's something else she works now. Sabi niya, tinext niya ako, could we have coffee one of these days? Kasi sabi niya, she wants to catch up. Ako rin naman gusto ko malaman ko kumusta na siya.
Ano nangyari. And ngayon, nakakatayo na siya ng
She's straight,
properly.
she walks around. Kahit nga mabangga siya, okay na Before sabi niya, nabangga ako, grabe.
Masakit na agad.
As in, masakit na agad.
Is there a possibility, Doc, na it's because of the cold, parang sabi natin isang room, lalo na yung mga offices na talagang ang air condition ay talagang nasa pinakamababang temperature na. Posible ba na mag-cause din yun ng neck pain?
Yeah, kasi may mga taong hypersensitive sa cold. You know, so kung nag-shiver siya all the time, tapos nagko-contract yung muscles niya all the time, sustained yun for hours on end, yeah, it could cause neck pain.
But yung iba, Doc, I believe narinig nyo na ito, na dahil daw sa lamig, kung bakit sila nagkakaroon ng neck pain. Is that true?
Well, I guess some people call it lamig. Some people would call it trigger point. But I guess we're both trying to address the same thing.
It's neck pain.
It's neck pain.
Na talagang yun yung hindi nagagalaw masyadong part ng neck.
May bulitas pa nga, di ba? May jawline daw sila.
Yes, oo. Tapos yung iba, dinudurog through massage. And is it naman, Doc, okay lang yung mga ganyan?
Most of the time it is, pero may mga times na talagang paggrabe siya. Hindi, I wouldn't advise it
Sobrang sakit
kasi mas lalong bubugbog Bubugbog.
So yung ganun, hindi naman siya ganun ka-advisable for
Yeah.
Lalo na kapag severe na yung
Yeah, kung severe na, you need a professional. Pero kung if it's a minor thing, tapos nakita niya pag nagpapamassage ka naman, okay naman, bakit hindi? Yung nga, pero kung nagpapamassage ka, after a few days babalik, tapos mamassage ulit after a few days, yeah, that's the time to contact a professional.
Pagka-frequent na siyang pabalik-balik.
Yeah, exactly.
Alright. Ito, Doc, para sa mga ganyan, nabanggit na natin yung mga home remedies, ano yung mga pwedeng mga treatments that you can offer them, lalo na dun sa mga talagang nagpapabalik-balik yung pain nila sa leeg?
In our office, we use what we call dry needling. We can do some dry needling, acupuncture. You know,
As in, tinutusok, Doc?
Yeah, kung area ito yung masakit, dito natin lalagyan. Unlike on a typical acupuncture, they put it on acupuncture point, I guess. As kung saan namin nakita yung trigger point, that's where we put it. Other thing we do is laser, yung pulse electromagnetic field naman, it's a magnet that helps you heal from the inside. And we have other stuff too, like the vibrocaster percussive siya, vibrating, that would, sabi ko nga, it melts the muscle in 20 seconds.
Alright.
Parang ganun kabilis, mabilis siya talaga.
Ang bilis, ha? 30 seconds. Lalo na yung may mga severe cases na pagdating
Pag sobrang tigas talaga, it takes a little bit longer, obviously. Pero, so of course, we do it a little bit longer. Kasi unang-una masarap When it hits you, parang, wow, kailangan ko yan. Diba? So,
how do you know, Doc, na yun yung kailangan ng patient?
we assess them first. You know, we check them. Tingnan natin yung range, tingnan natin yung strength, tingnan natin kung meron ba mga trigger point o sinatawag nga lang lamig-lamig around the area. And when we see a bunch of muscles toned up in there, titingnan natin, kailangan ba natin yung tonicity na yun o hindi? Pag nakita natin, wow, we don't need it, so we need to get rid of it. Pero kung kailangan natin, we keep it that way.
With acupuncture, Doc, is it the same with Chinese treatment na acupuncture?
I guess the difference is they put it in acupuncture points. So kung masakit ang leg mo, maaaring lagay nila sa some part of your body, maaaring sa fingers. With us, we put it directly on the muscles. We hit the nerves. Sometimes we even hit the bone.
How does it work, Doc, yung acupuncture dun sa clinic ninyo?
Kung nakagrab yung muscle ganyan, tinusukan natin ng needle, it will try to open up.
Oh, I see. Ano yun? Without any apparatus? Talagang yung needle lang?
Needle lang. If the positioning is right, if the placement is right, it will open up. We usually leave it there for about 10-15 minutes.
Okay.
And then we take it off. And after maramdaman niya, wow, it's feeling great. Or sometimes, I always tell patients na, okay, within 48 hours, you should feel that this has something on effect on you. Di ba? Parang Kasi may mga tao hindi agad nila nararamdaman. Pero within 48 hours, they come back. They're like, man, after you did that, look at me. Parang okay na.
Naigagalaw na niya
Igagalaw
ulit.
niya.
Yung mga ganyan, Doc, meron yan na parang pwedeng gawin lang through, parang lunchtime, through breaks lang.
Yeah.
Pwede na.
It's something quick that you could do. Kung malapit lang yung office namin sa inyo, some people sa Binondo, lalo sa Binondo, they run to our office during break time and then they go back to work.
Trabaho na ulit. Tapos
Trabaho na
wala
ulit.
namang problema.
Yeah.
Kasi for massage, Doc, usually pagka sinabing nagpa-treat sila sa isang massage parlor or something, hindi sila pwedeng maligo. With that kind of treatment, okay lang?
Hindi naman. We don't limit people. From, bawal kang maligo, bawal ka sa malamig, o bawal ka kumain ng talong, whatever. We don't do that.
Okay.
we don't really contradict it.
So talagang okay lang naman. Tsaka wala naman siyang Doc, no? Walang baga surgery or anything, just the apparatus. No?
Yeah.
What you're gonna do, Doc, is magla-lie down ka lang, ganun lang yan.
Yeah, it's not.
Just relax. Ganun.
Oftentimes kung neck, pinapaupo ko eh. Okay, we have a massage chair, nakaganon sila. They're really positioned. We put the needles around the back area. And then we work the patient sa ganung position eh. So every now and then I'd say, okay, I want you to stretch it out a bit. And then we continue.
And then yung mga sessions nun, Doc, how frequent yung mga ganyang klase?
I'd say 2 to 3. 2 to 3. Kung gusto mo agad matapos, 3 times a week para mas mabilis.
Okay. And then after that, sigurado naman na marirelieve ka na from neck pain?
Usually, we don't accept people na on the first visit na walang improvement eh. Pag walang improvement, we don't tell them to come back.
I see.
Just say, you know what, I don't think this is the right therapy for you. Maybe you need something else.
At least you're saying naman the truth, no?
Oh, yeah.
Hindi nyo sila pinapaasa for some point.
Magagalit lang sila sa akin eventually, di ba?
Yes, parang sinasabihan na pinaparahan nyo lang kami or anything.
Okay.
Di ba? Alright. Ito, Doc, para dun sa mga pasyente na ganyan na nag-iisip na para pumunta sa inyo, anong po muna yung pwede ninyong ma-message sa kanila, advice, na para hindi siya bumalik ulit. Kasi di ba usually, lalo na nabanggit nyo kanina, pag nagpa-massage, after the massage, babalik na naman. Then they have to go back to the massage parlor again para magpa-massage and all. Tapos bumabalik na naman. So ano yung pwede nyong i-advise for them para hindi na siya totally and permanently bumalik?
Well, guys, you need to do your home remedies. Yung home remedies na discuss natin today, do that as often as you can. Be disciplined about it. Oftentimes kasi nakakatamad, di ba? Kung tinatamad kayo yung mga anak ninyo, yung mga pamangkin ninyo, make them do it. Now, do it at home, do your home exercises, na in-advise ng PT ninyo para hindi siya bumalik. And, home remedies, exercises, and kung talagang hindi siya nawawala, then that's when you come and see us.
Alright. Okay. And speaking of that, Doc, i-advise ko na kayo to let the viewers know kung saan ba nila kayo pwedeng puntahan, lalo na doon sa mga gantong klaseng pains.
Yes, we're all over the place. Active Life Chicago PT is all over Metro Manila. We have 9 offices right now. You could call 997-5704 para may direct nila kayo kung saan mas malapit sa inyo.
And ano po yung mga clinics nila, Doc? Saan po ba nila kayo makikita?
Yeah, we have Shaw, Mandaluyong, Alabang, Quezon Avenue, Fairview, Caloocan, Binondo, Santa Rosa na Valley, saan pa ba? Makati, and I'm forgetting one. Yeah,
and coming soon, may mga susunod pa,
coming
Doc.
soon, Pasay, BGC, and San Fernando, Pampanga.
And of course, meron kayong Facebook page, Doc, di ba? Para ma-visit nila kayo for inquiries.
Yeah, visit us at Active Life Chicago PT. Just type it on your Facebook page. And makikita niyo yung mga videos natin, mga before and afters. Those are mostly first visits, no? Yung results nila.
Alright, ayan. Marami na kaming nalaman, Doc, tungkol sa neck pains. At marami palang Doc, no? It is really important na i-address siya agad kasi possible na meron pa siyang, kumbaga, implications na iba pa.
Yeah.
Complications and all, na mas maging problema pa in the near future.
Yeah.
So, importante yan na lagi niyong ma-check ang inyong pangangatawan. At ito nga, napakabilis talaga ng oras. But before we say goodbye, ayun nga, Doc, i-invite nyo na yung mga viewers natin to check you out, syempre sa Facebook, lalo na doon sa mga sa mga may katanungan, para directly kayong sumagot sa kanila. Sumasagot naman kayo, Doc, no? Directly.
Directly.
Parang on time naman kayo
So far, I think within 20 minutes, nasagot ko naman.
Alright. Alright, ito na. Magtatapos na po tayo and maraming salamat ulit, Doc, for going back.
Thanks.
Ang bilis ko talaga makausap to si Doc. Anytime talagang ano siya, open siya para sa atin. Lalo na doon sa ating mga viewers sa ating Facebook Live na talagang maraming nagko-comment sa atin at nagtatanong kung ano ba yung kanilang pwedeng gawing remedies lalo na doon sa mga may problema sa kanilang pangangatawan. Ayan, maraming salamat for always sticking with us at syempre doon sa mga nagtatanong, keep on sending, keep on commenting yung mga problema ninyo, i-comment nyo lang sa ating comment box down there. At directly ay sasagutin po natin yan. Of course, with Doc Ron Samaniego. Maraming salamat po for sticking with us. At next time, wag po kayong aalis dahil magbabalik tayo with another topic na talagang siguradong inyong magugustuhang pag-usapan. Maraming salamat at magbabalik po. Ako pa rin po ang inyong nakasama. Ako po si Vian Dacles. Magbabalik po ang inyong programa, ang Pinoy Health and Wellness.